The concept of prudent healthcare is all about service improvement. It's about finding ways of not doing things that aren't to the benefit of patients in order to create the space, the time, the money as well to do more of those things that we know are to patients' advantage. So improving services for patients is at the very heart of the prudent healthcare agenda. Now we know, difficult as it is sometimes to explain this to people, that a lot of what goes on in the healthcare world either does people harm or does them no good. Healthcare acquired infections, the clue is in the title, isn't it? These are infections acquired as a result of receiving healthcare. So healthcare can do harm as well as doing good, and we need to bear down even further on eliminating that harm. And we know as well that the nature of knowledge changes all the time, that evidence is always emerging, and some of the things that we believed were effective in the past, we now know have been overtaken by other ways of doing things that are more effective. And therefore we have to do more to drive out of the system those inherited ways of acting that no longer provide the best outcome for patients. And there's a great deal of help for us in all of this. NICE provide all sorts of advice and evidence on things not to do. We have the interventions not normally utilised list in Wales, which we are reviving and trying to give a bit more impetus to. And there's work going on across the world now. Canada, for example, the Choosing Wisely Canada initiative, which gives clinicians very precise, very direct, very practical advice about things not to do because these things are known not to have a clinical effectiveness.